In this case study, we're going to do a deep dive into SIBO, or small intestinal bacterial overgrowth. My practice, Scheer Nutrition, works a lot with very tough to treat SIBO cases, and this client had gone to many conventional and functional practitioners. She had gotten the diagnosis of SIBO, but she struggled to heal her gut. She would continuously relapse and relapse over and over again, despite doing all of the antimicrobials and even the standard antibiotics of Rifaximin and Neomycin. So let's take a look at her case, what was missing in her healing journey, and what we did to finally fix it for good. By the time Deanna had come to my practice, Scheer Nutrition, she had already worked with multiple conventional and functional medicine practitioners. She had been given the diagnosis of SIBO, small intestinal bacterial overgrowth, and received various treatments, the typical round of Rifaximin and Neomycin. This is an antibiotic protocol for the treatment of SIBO, and she had done various herbal protocols. But despite all of these treatments, she continued to relapse over and over again. She was struggling with chronic distension and bloating. She was struggling with constipation. She was struggling with skin issues, acne, and she was even beginning to develop anxiety as a byproduct of all of her gut issues. Now, Deanna was an athlete. She was very fit. And so this started to take a really big toll in her confidence and her ability to perform at a high level, and not to mention just the overall symptoms and how that was impacting her quality of life. The first breath test that we did on her, a breath test, is really the gold standard when it comes to diagnosing SIBO. And a breath test is going to measure the amount of hydrogen and methane in the breath after consuming a specific type of sugar. Often lactulose is used. And when we have a small intestinal bacterial overgrowth, we start to get bacteria that moves upstream into the small intestine. As we're eating different fibers, carbohydrates, and sugars throughout the day, the bacteria are going to produce hydrogen or methane gas, and this is going to cause an expansion of our intestines and leading to all of the bloating and other GI issues that accompany it. And so what we're looking at is, after consuming a specific type of sugar, what is the amount of hydrogen and methane that is produced, and we want these to be below a certain threshold. And Deanna's combined hydrogen and methane levels were at about 25 parts per milliliters, where we want that below 15. So we did suspect a positive case here of small intestinal bacterial overgrowth, and you can see what these looked like over time while we did that breath test. However, one thing to note about SIBO is a diagnosis of SIBO is not enough, because SIBO is not the root cause. It's actually part of the symptom. And one of the reasons why people continue to relapse over and over again with a lot of these standard protocols and treatments is because they're just given a diagnosis of SIBO, given an antibiotic or an herbal protocol and some motility support, but we don't actually ask, why did the SIBO develop in the first place? And so we have to run other lab tests. We have to look at what's happening with the hormones, the thyroid, what's happening with the nervous system, absorption, medications, stress levels. All of these things can lead to the development of SIBO, and it makes sense. We can lower bacteria all that we want, but if we don't get rid of what is causing that bacteria to overgrow, we're going to continue to relapse. And so that is exactly what was happening with Deanna before she came to my practice. But through other testing, this is a stool test, and then a blood work test, and then some metal testing that we did on her, we actually found out she had some digestive insufficiency. So you can see here she was struggling with some fat absorption. She had hypothyroidism, so her thyroid was really low, and this was impacting the motility in her gut. So she had some MMC disruption. We have something called our migrating motor complex. I call that our MMC, which are the cleaning waves that sweep bacteria, foods, and toxins through our gastrointestinal tract. Bacteria can begin to overgrow in the gut because we're not getting the cleaning waves that our gut really needs. She had a lot of stress from training really hard, being so lean. And so that was also impacting her nervous system and the motility. She was on oral contraceptives, and there is some research that oral contraceptives can contribute to bacterial overgrowth in the gut. And you can see here that she had the toxic heavy metal beryllium that was a bit on the high side as well too. Other things that were contributing to Deanna's GI issues and her relapse with SIBO over and over again is her immune system was really suppressed. Now we can see the immune system suppressed in the gut when there is SIBO, when there is dysbiosis, when there is toxic heavy metals, which we knew to be true with Deanna, or the body is under a tremendous amount of stress. But we know her immune system was really suppressed. She had a bit of non-celiac gluten sensitivity, so her body was creating some antibodies to gluten, and then she had some leaky gut. And so fecal zonulin is the marker that we look at for any kind of leaky gut. It was really the full picture of everything that was happening with Deanna, but getting to the root cause was really the first step beyond just the diagnosis of SIBO. With my practice and my institute, these are some of the things that I teach. What led to SIBO in the first place? And there's really 4 areas that we look at. Things that can impact motility, so autoimmune conditions, anything that's going to impact the body's migrating motor complex, the history of TBIs, poor vagal tone, hypothyroidism. So we saw a few of these with Deanna. Chronic infections, diabetes, mold, dysautonomia, scleroderma, anything that's going to impact digestion and absorption. So this could be any kind of microbiome dysfunction, low secretory IgA. Again, we saw that with Deanna. Low pancreatic enzymes, low bile flow, low stomach acid. This could be anything that's going to impair the flow of food through the gastrointestinal tract. And so we'll sometimes see this with endometriosis, people who've had abdominal surgeries and have developed adhesions in the gastrointestinal tract that are blocking the transit of food. And then we know various medications can impact the gut biome and lead to SIBO. Opiates, narcotics, antispasmodics, PPIs, various antidepressants, T4 only medications can also play a role. And so what we did for Deanna is we first started working on her nervous system through some gut-brain axis support. We then set the foundation, making sure she was on a good low fermentation diet. We started optimizing her body's migrating motor complex. We removed gluten and dairy from her diet. We then transitioned her into doing another antimicrobial protocol, but that was more specific for methane predominant SIBO. We did various targeted probiotics. And then we also implemented some carbohydrate cycling to try to target the bacteria when it was actually fermenting on some of these carbohydrates, but then mitigate symptoms by going lower carb. Because she had some digestive insufficiency, we did support absorption with betaine HCl, various digestive enzymes. We did some leaky gut repair. We did some immunoglobulin support for her immune system. And then after we did this treatment, we then focused on prevention by supporting her body's migrating motor complex, continued with various enzymes, betaine HCl, and ensured that her thyroid was optimized. And so once we completed this entire functional medicine protocol, which took about 6 months, we then retested with another breath test. And you can see here, this was Deanna's current results with her hydrogen and her methane levels. So all of these were now within the range that we wanted them to be. Looking at her symptom scores from where she started, her bloating was at a 10. Her constipation levels were at an 8. She had a good amount of fatigue, anxiety, and her skin issues were also pretty high too with acne. And by the time we had done all of these treatments and retested, her bloating had gone from a 10 to a 4. Her anxiety levels were non-existent. She had a 3 when it came to her skin issues, and her energy levels came back. We can say that Deanna's life was completely changed. And here is a photo of Deanna before and after. So pretty remarkable. This is the power of taking a root cause approach. And just to recap, some of the reasons why most treatments fail when it comes to SIBO is because we're only focused on eradicating the bacterial overgrowth. We're not actually healing the gut after. Just because we're killing bacteria doesn't mean the gut is healthy. We have to get the microbiome healthy to be able to prevent this issue from coming back as a whole. We're not addressing the underlying causes of what led to SIBO in the first place. We're not focusing on prevention and maintenance, and we're not looking beyond SIBO. Sometimes it's SIBO, sometimes it's parasites, sometimes it's fungal related, sometimes it's digestive insufficiency, sometimes there's a food intolerance. Make sure you're working with a practitioner who's looking at you, looking at your full story, looking at the full picture of what is going on, instead of just running a test and then giving you a protocol. So as you guys can see from Deanna's case, SIBO was not the root cause. SIBO was part of the symptom. And one of the things we have to make sure we do is address why these problems are happening in the first place, or you're going to continue to relapse over and over again. So if you are somebody who's struggling with chronic gut issues, you've been given a diagnosis of SIBO or IBS, and you want to finally heal and get to the root cause of your chronic gut issues, you can go ahead and book a call with the link below to learn more about my functional nutrition approach.